Remember, start implementing positive lifestyle habits before the development of symptoms.
Welcome to the Ultra Healthy Now podcast, where your journey to feeling younger, sexier, and more energized begins. Dr. Nicole Srednicki, who specializes in high-performance health, will dive into practical, actionable tips and strategies that can transform your physical, mental, and emotional well-being. Join us as we uncover the secrets to living a healthier, happier life, mind, body, and spirit. Because true health, beauty, and happiness start on the inside.
Hello, and welcome to the latest episode of Ultra Healthy Now, your weekly podcast where we explore the journey to maximize your health. I'm your host, Dr. Nicole Srednicki, founder of Ultra Healthy Human, where we specialize in high-performance health for high-performance people. We've had a 3-part podcast series about brain health and reducing the risks of memory loss. In part 1, we talked about Liza's story with her strong family history of Alzheimer's and her determination to beat it and how. Now, if you're young, you may want to stay tuned in because 1, you could pass this information along to your mom, dad, or grandparents. And 2, you can implement some of these steps into your life even now. Remember, start implementing positive lifestyle habits before the development of symptoms. So for Liza, we created a process of achieving 4 goals through a 3-step program: brain health, reducing inflammation, improving her metabolic function, and setting her up for long-term success. The 3-step program included, first, comprehensive labs to look specifically at some of these markers; 2, lifestyle modifications; and 3, introducing new therapies. So part 1 covered steps 1 and part of step 2. And then in part 2, we had our special guest, Dr. Radha Gopalan, a master of Eastern and Western medicine and a heart transplant cardiologist. And he gave us insights into how to identify and align with our inner being. Today, in part 3, we're going to discuss therapies to support cognitive health and reduce the risks of memory loss. Before we jump in, I want to cover a question that was sent in. Is there a test to see if you have Alzheimer's? The answer is yes. There are a series of questions and testing to screen for this. So Kara asked about her mother. She said she's concerned that her mother isn't remembering events. So I asked her to give me an example. Her mother asked her daughter when she's graduating with her master's degree. Kara explained that she actually graduated 3 years ago. She said that her mom is super busy and stressed all the time, and her daughter isn't living at home since she started college about 8 years ago. And so it's kind of understandable since her daughter moved out a long time ago, but it's also concerning that it was so long ago. So in this case, I recommended that she seek evaluation. The first step of this testing is usually a clinical assessment where the doctor will ask questions about memory, changes in personality, or signs of depression. Next, cognitive testing will be done with simple tests like memory recall, something called a mini mental exam, or the clock drawing test. Then a psych evaluation to rule out other causes might be carried out. And then the doctor may suggest doing some imaging like an MRI or CT scan looking for shrinkage of the brain. Now, in high performance health, we might also look at something called an energy scan. So last week, we discussed this with Dr. Gopalan. At Ultra Healthy Human, we have a test that helps to identify emotional attachments, energetic imbalances, and inflammation. And this energy test will reveal if there's changes happening at the level of the brain. And this could alert us to looking a little bit deeper within that area. Then there are some blood tests that can be done, looking for things like beta amyloid peptides or tau protein, or even just inflammation, because that can kind of show us there might be subtle signs. There is also a genetic test that can be done. Some of you may have already done this through 23andMe or some of these other genetic testing sources, or you can test specifically for this. So there is a genetic marker called APOE. 1, 2, 3, and 4. APOE4 actually shows that you may have an increased risk of early onset Alzheimer's, and APOE2 actually shows there may be more protection. Now, it's nice to have this information. However, there are some ethical considerations. How is this going to affect your thought process, right? So if you were positive for APOE4, now you're like, oh my gosh, I have increased risk of developing this. So then every step you take along the way, you might be thinking about it. You might start fearing it. As Dr. Gopalan talked about, now you have this internal dialogue going on, and you may be consumed with fear as a result of this. So sometimes kind of the effects of knowing that might not be good. Why not just start making these lifestyle modifications now and just lower your risk factors of developing it? Because just because you have that genetic mutation doesn't necessarily mean you will for sure get it. But we don't want fear to consume you. So I kind of discourage against doing this test, but if you do decide you want it done, I do recommend seeking a genetic counselor that can help to navigate through it. So now let's talk some therapies and interventions. Beyond lifestyle changes that we already discussed, what else can we do? This is where anti-aging medicine comes into play. And this is also really exciting because, I'm giving you tools to implement into your life so you can lower the risk. So you don't have to fear this memory loss or these horrible words, Alzheimer's, dementia. We can do things now. So when we look at anti-aging medicine, this is slowing or reversing the aging process so that we can live vibrantly, so we can have mental clarity. And anti-aging isn't just trying to look younger. It's about feeling younger too. It's about working internally. And this includes your memory. So a great thing where there's a lot of research being done is hormone balance for both men and women. Remember Liza, my patient that I've been talking about, her hormone levels were out of balance. So this can actually accelerate aging and memory loss. So for Liza, we've worked to correct these imbalances, particularly intersex hormones and cortisol levels. And balancing these hormones plays a big role in maintaining brain health. So there's something called bioidentical hormone replacement, or BHRT, which is used to treat symptoms associated with hormonal imbalance or decline. Let's look at some of the research for BHRT and how it can play a role in slowing or reversing memory loss. So we know hormones can impact the brain. Certain hormones like estrogen, testosterone, these have significant effects on brain function, including memory. Estrogen, for example, is known to enhance memory and cognitive functions by affecting neurotransmitter activity and neuroplasticity. Testosterone similarly influences memory and cognitive ability. Neurotransmitter activity involves chemicals in the brain that transmit signals between cells. These chemicals like dopamine or serotonin, or what I like to call your happy hormones, help to control these various functions such as mood, sleep, and learning. Neuroplasticity is the brain's ability to adapt to changes. And so this is so important for learning. So when we look at some of the specific studies, for women, there was a study called the KEEP study. It had about 700 women, and it evaluated the effectiveness of hormone replacement therapy in preventing both heart disease and cognitive decline in younger postmenopausal women. The results showed that early interventions with low-dose bioidentical hormone therapy might be beneficial in maintaining cognitive function, thereby reducing the risks of memory loss associated with aging and menopause. This study is important because it helps us to address timing. So we want to start hormone replacement therapy early, and you want to have the most effective, lowest dosage for these benefits. So this suggested that early low dose interventions might be the key to maximizing the benefits and minimizing risks. So this means do something now. Don't wait till symptoms are already there. When women start to actually go through subtle perimenopause symptoms, it can start happening in your late 30s. So it starts happening early. So start seeking out information for yourself. Maybe have consultation so you can start to get an idea of like, how can we do things now to prevent issues down the road? So this is a rapidly advancing field. And so tons of studies are being done. So be on the lookout for changing evidence and more to come to support this. So for men, there's a notable study called the T trials this was with over 800 men, and this examined the relationship between testosterone replacement and memory enhancement. And the results indicated that testosterone treatment significantly improved all aspects of sexual function, mood, and depressive symptoms, which are indirectly related to cognitive health. And we all want to maximize that, right? So this study concluded that testosterone treatment can improve some aspects of cognitive function in older men with low testosterone levels. The study did highlight the need for personalized approaches in hormone therapy. And so what does this mean? Finding a doctor who will look at all aspects of your health, utilize the best sources, application, dosing, and monitoring. We've actually had a couple specific podcasts on bioidentical hormone replacement therapy and testosterone therapy and all of these good things. So you can tune into some of those. Another study, the UCLA study, suggests that testosterone replacement therapy can potentially slow the progression of cognitive decline and reduce the risk of developing Alzheimer's disease in men with mild cognitive impairment. Awesome. So we see that there's a lot of really supportive evidence behind utilizing bioidentical hormones. So what else can hormones do? It's been shown that there is protection against neurodegeneration. This is like the breakdown of your brain. So evidence is beginning to accumulate suggesting that hormones like estrogen can provide neuroprotective effects, reducing inflammation and oxidative stress in your brain, which are factors that contribute to neurodegeneration. We've covered a lot about inflammation and oxidative stress in part 1 of this 3-part series. Remember, oxidative stress is like rust on your car. If there's no protection, it's going to break down your car. You need to protect your body from oxidative stress to keep it strong and vibrant. So what else can hormones do for our body? It can improve mood and sleep, both of which are crucial for optimal brain function and memory. BHRT can help to stabilize mood swings and improve sleep patterns, which in turn can enhance cognitive functions and memory. It can also increase blood flow. So estrogen can actually increase blood flow to the brain, which can improve nutrient and oxygen delivery, enhancing overall brain health. Remember, your friends and family will thank you when you remember their birthdays this year. This can really, I have a lot of patients that come to me just looking for anti-aging or they want to maximize their health. And so when we put them on some of these bioidentical hormones, they realize they're like, I have less brain fog, I have like mental clarity, sharper thinking, better concentration. So a lot of health benefits there. It is important to remember that BHRT differs from HRT, so just traditional hormone therapy replacement. We've covered this all on another podcast. Make sure that you're weighing out the risks versus benefits of any hormone therapy and make sure that you are monitoring levels with your doctor. So the next section that I want to cover is vitamins and supplement protocols, the good versus the bad, beneficial supplements and some ingredients to actually watch out for that can be detrimental. So we're going to talk about Liza's supplement protocol. We put her on some omega-3 fatty acids because according to the MIDAS study, this was almost 500 participants. The study showed that there was strong evidence that DHA supplementation can significantly improve memory function in older adults with mild cognitive impairments. Next, we also put her on Ultra Vitality. This is one of the ultra healthy human supplements, which focuses on anti-inflammation. Some of the ingredients that are in this include berberine, ginger, boswellia, quercetin, bromelain, camu-camu, all of these showing they have positive neuroprotective effects and reduction of inflammation and oxidative stress. Another component in it is green tea extract, which is shown to be very high in antioxidants, and that can improve memory. There's also lutein, which can accumulate in your brain and may protect against cognitive decline. So a really powerful supplement. The next one is vitamin D. This has shown to help with brain health. And then we're also focusing on improving her gut health, which directly impacts the brain. So we've added in some probiotics and a diet that's rich in prebiotic fiber. So Liza is also on a blood sugar support supplement called Ultra Glucose Guard. And that one of the ingredients in that is berberine. And a study on berberine shows the effects on blood sugar and its correlation with cognitive function. It showed that improved blood sugar levels with berberine can have a positive impact on cognitive function. So that was just kind of going through a few of like the really good supplements or key ingredients that you want to look out for. Now let's talk about some of the bad things, because unfortunately, when we look at brand quality and sourcing, we always want to be careful because sometimes there is junk added to supplements. So, when it comes to supplement ingredients, some ingredients, they can actually be harmful for brain health, cognition, and can increase risks of conditions like Alzheimer's, dementia, and memory loss. So I want to highlight a few of these potential negative effects. There are sometimes, especially with omegas, you want to be really careful that there's specific labeling that they have been tested for heavy metals, because a lot of the omegas are coming from fish sources. And we know there are certain fish sources that unfortunately have a lot of mercury in it. So you don't want to be taking a supplement and just ingesting heavy metals. A lot of studies showing how bad heavy metals can be for brain health. Also, specifically to omegas, you want to make sure they are blister packed. So that means they're like individually wrapped. So when you think of things like a Z-Pack antibiotic, right? They come in each pill is in a specific place. Omegas can actually oxidize very quickly. So remember that oxidation is kind of like rust. They basically become rotten. And so some brands will actually just start adding flavors in it so you can't taste that rancid flavor. So be very careful. You want a blister packed omega specifically. The next thing you want to watch out for is dyes. Dyes have been shown to cause neurotoxicity, which is poisoning in your brain. So, when you see like red color or blue, you want to definitely stay away from these. And then natural flavors. There's a lot of supplements. It could be a powder form or even I'll go back to omegas and a lot of others where they actually add natural or artificial flavors. And this is kind of like a catch-all term for a variety of different chemicals. So of these chemicals, they may have neurotoxic effects and contribute to, again, that oxidative stress, which is a known factor in neurodegenerative diseases. So a study in the Food and Chemical Toxicology Journal discussed how certain flavoring agents could induce this oxidative stress, contributing to neurodegeneration. So please make sure when you're picking up those supplements that it's coming from a trusted brand, trusted sourcing. And, you can always ask your doctor for recommendations on quality, or we have a lot of information on our website at ultrahealthyhuman.com. And you can always reach out and ask questions. So next, we're going to talk about some more advanced therapies. We've also begun using intravenous laser on Liza to reduce inflammation in the brain and enhance formation of new brain cells. There's also another procedure called V cells, or very small embryonic-like stem cells, or what I like to call youth cells. And these are a type of biologic therapy which involves a specific set of cells from within your body. We actually pull these out of your body. We separate them, we activate them with a laser, and then we guide them to specific areas within your body with this laser. And V cells have shown to improve cognitive function by forming new or regenerating brain cells. And brain cells are like little computers in your body. So they take part in sending, receiving, processing information to coordinate everything from muscle movements to complex thoughts. So this is super important. And other research around V cells has shown that there are neuroprotective properties. It's shown to reduce inflammation and support neuroplasticity, which is that ability to learn and adapt. It's important to remember that this information is rapidly evolving and more studies are underway to understand their potential and limitations. But there's a lot of really promising information out there about V cells and the positive benefits. So now we're going to talk about Liza's results and her next steps. It's been about 3 months since we started Liza's journey. She's lost about 15 pounds, but more importantly, her energy levels have increased. She's sleeping better, and she's noticed improved focus and mental clarity. It's a marathon, not a sprint, and we're still fine-tuning her plan. I hope that Liza's determination has been inspiring for the listeners, seeing how some of her interventions have already impacted her health outcomes. For anyone listening today, I hope that Liza's story reminds you that no matter your family history, you have the power to make changes that positively impact your future. Prevention isn't just about reacting to a diagnosis. It's about proactively building the healthiest life possible. Even if you didn't watch the last 2 episodes, get your pen and paper because here we go. I'm going to talk about your take-homes. We have 8. Number 1. Remember, start implementing positive lifestyle habits before you develop symptoms or progression to an illness. Number 2, inflammation, sugar, and stress equal cognitive decline and also increase Alzheimer's risks. Number 3, on a positive note, have some coffee. There's actually some benefits to that, but not in excess because then it can turn into negative health effects. Number 4, as Dr. Gopalan talked, be mindful of thoughts. Identify how often you're thinking of your issue. Are you distracting yourself with social media, TV, food? Break these negative inner roommate interactions. If you need help with this, there are special counselors for emotional cleansing and also energy scan testing. Number 5, consider anti-aging therapies like low-dose bioidentical hormone replacement. The key is starting early and with a personalized approach. Number 6, supplement regimen. Make sure you're having good therapeutic doses from high-quality sources. Remember, not all supplements are created equal. Some supplement ingredients can actually be detrimental to your health. Check the brands and not just the supplement facts, but actually other ingredients. So when you look at supplement facts label, usually in a little bit smaller writing, not highlighted, you want to check out those other ingredients. You can also find more information or if you have questions on ultrahealthynow.com. Number 7, the underpinning of all of this is toxins are in your organs and they're already existing and affecting your body. Begin with an ultra healthy detox. Remember, reduce stress, reduce inflammation, stop eating sugar, ultra processed foods, and artificial foods because all of these are toxic. And number 8, you can influence your health outcomes. Thank you for joining me for another episode of Ultra Healthy Now. If today's episode sparked your interest in achieving your maximum health potential, or you want to put together a plan to reduce your risks of developing memory loss, I invite you to contact us or visit us at ultrahealthynow.com. Explore our specialty formulated supplements, ask questions, suggest topics for the Ultra Healthy Now podcast, or you can schedule a consultation. Join us at Ultra Healthy Human, where your health, beauty, and happiness begin from inside. Thank you.
Thank you for tuning in to the Ultra Healthy Now podcast with Dr. Nicole Srednicki. To discover more, visit ultrahealthynow.com and jumpstart your wellness journey with our 21-day detox program, a total body reset, more energy, better focus, and weight reduction. Our carefully formulated, high-quality supplements will aid in a new level of wellness. Don't wait. Unleash the ultra healthy human within you. At Ultra Healthy Human, Eastern and Western modalities are combined with cutting-edge technology to guide personalized health programs to help you tap into the limitless potential of your mind and body. Because true health, beauty, and happiness start from within. Remember to subscribe, like, and share this episode wherever you listen to podcasts.
And before we sign off, I want to make it crystal clear that the information presented here is for informational and entertainment purposes only. This episode should not be considered a substitute for professional medical advice, diagnosis, or treatment. And while we strive to provide accurate and up-to-date information, the content discussed in this podcast is based on general knowledge and research available at the time of recording. Medical knowledge and guidelines can evolve, and what we discussed may not always reflect the most current research or recommendations. If you have specific health concerns or questions, we strongly encourage you to consult with a qualified healthcare professional or medical specialist who can provide personalized advice tailored to your unique circumstances. Every individual's health situation is unique, and what works for one person may not be suitable for another.
This podcast is a presentation of the Rich Dad Media Network.